Good afternoon, everyone. Here we are again for another Q&A session with Barbara. And let's kick off with the first question, please.
Okay. We're getting a lot of questions from guys, which is nice. James is asking, I'm 24 years old and I've always had one side of my face that's asymmetrical. What non-surgical procedure could bring some symmetry to my face?
So now that's an interesting question because it's too vague. Asymmetry of the face could mean different areas that are asymmetrical. It might be an eyebrow, it might be a chin, it might be a jaw. So I think really careful assessment again will dictate what kind of treatment is most appropriate. So for example, if it was a different eyebrow height, that would probably be best treated with Botox. If it was a difference in the jaw width, again, that would be treated with a filler. If it was an asymmetry with the cheek, again, that would probably be best treated with a filler. But again, we're looking at different types of fillers in these particular areas. If it was a tear trough, for example, that was asymmetrical, and again, you're dealing with a filler, but a much finer one. So I think the other thing to appreciate is that most of us are asymmetrical, and the asymmetry, if it's small, is not worth correcting, because by doing so, you can actually make it worse. So I think it really comes down to how significant and whereabouts that asymmetry is. Also, is there any history behind that asymmetry? I have a few patients where they've had accidents or road traffic accidents where the asymmetry is a result of trauma. So that's very different as compared to more of an aesthetic type of asymmetry.
So best for James to make a
Seek
appointment for a consultation with his doctor, experienced doctor, so he can go over some of the options.
Yes, I think that's definitely for the experienced medical practitioner. I think the history is very important behind that. Another cause of asymmetry, for example, would be a nerve damage or palsy. You can typically get that with a Bell's palsy or facial nerve palsy. So again, these are important questions to ask with the history taking and the clinical examination.
Okay, James, it's treatable, but have a consultation.
Yeah.
Charlie is 23 years old and wants to know the best option to improve his jaw.
So we're talking a young person, not Charlie, your husband. So we do get a lot of questions about chins and jaws, particularly in the young male. And I think we're seeing more of this, particularly with the chin, where people have weaker chins, usually from a dental perspective, where they may have a class 2 overbite. We generally will use fillers to correct or chin projection, and that in itself will restore some of the jaw contouring. Obviously, as we get older, we tend to lose that definition here, so we will use fillers to enhance that contour again. But if it's a younger person, it may just be that they need to, again, have a good assessment. They have a narrowness to their face? Is it more feminine? Do they want to be more wider, more masculinized with the jaw itself, with the treatment there? Generally speaking, we're going to be using fillers. But again, I think a careful assessment with an experienced practitioner is required here.
But it also affects a lot of mature women as well as we get older.
And yes, absolutely. As we get older in both sexes, we tend to lose the definition here along the jaw. usually as a result of support loss at the angle and some changes at the chin, and also descent of soft tissue from the midface.
Okay, good. Georgie writes, my left eyebrow is higher than my right eyebrow. Can Botox fix this?
So we had a question earlier about asymmetry, and this is something that we do see quite a bit. People will have a difference in the elevation, if you like, or the resting position of the eyebrows. And it's typically treated with Botox. You can use Botox in very specific areas to elevate the eyebrow, or in some cases, you may want to drop the eyebrow a bit. It depends whether there's a hyperkinetic aspect to the muscle, whether there's a different ways of looking at that assessment again for treatment with the Botox.
Have you had patients who have had
Quite a
this
few.
kind of,
Yeah.
really?
Yeah. So this is not uncommon.
Okay. Sometimes, you think you have a unique problem, but it's not.
Not really.
A lot of them are common, like
They're very
the eyebrow.
common. Yeah.
Okay, Susie's asking, how long should I wait after having a rhinoplasty before moving forward with filler? It's been 5 weeks since I've had the surgery.
So with any surgery, typically the healing process will be anything from 6 months to a year. When you have surgery, particularly in the face, you will get a lot of swelling, and that swelling itself will take a while to go down. So if you were to start treating someone too prematurely, you could treat them in the wrong way because you have a distortion, if you like, of their anatomy, or what the appearance of certain things. So you do need all of that healing and that swelling to go down. So in an ideal world, you are going to leave it for a good 6 months to a year before you consider any filler treatments. That's
good advice. Jan is asking, I'm 22 years old and my face is wide, square-like a masculine. Are there any procedures that would narrow down the width of my face?
So in a female, it's not unusual to see squaring of the jaw. Everyone has different facial shapes. If someone does want to get rid of that squareness, there may be reasons for it. So it may be a sort of congenital thing. You've grown up with a squarish type of face. That's just your facial shape. Or it may be that you have mesenteric hypertrophy, which is really the muscles here are much thicker and bulging. And that may be associated with other things like bruxism, jaw clenching. In which case, you would treat that with Botox to slim the muscles. The other thing that you can do is, again, if you've got a squareness here, you can start to use fillers along the cheekbone here so that you're widening this area here so that this gives you the appearance of a slimmer face and gets rid of the squaring.
That makes a lot of sense. I find that we get a lot of questions from young people who look in the mirror and have certain insecurities, whether it's the nose, whether it's James asking, for more symmetry to his face, Jan asking her face is too wide. They're all young people. You've gotten a lot of new young patients, haven't you?
I have, and I think that what we've seen certainly over the last 5 years, perhaps a bit longer than that, but certainly in the last 5 years, where people have been using Zoom consultations. I think also with the use of social media such as Instagram, that everyone's now seeing themselves and is therefore being more critical about themselves at a much younger age. So we now have a new style of aesthetic procedure medicine, if you like, which is not really about the anti-aging or the prevention of aging, but it's more about beautification or correction of some minor asymmetry, minor problems that people perceive.
Insecurities, basically.
And yes, to a certain extent, insecurities. And again, I think it goes back to the old thing, which you have to have a consultation that is, will address some of these issues. Is this a real need? Is this more psychological? Is this a body dysmorphic syndrome? Is this something that shouldn't be treated as much as it should or can be treated? So I think there are cases, where it is worth doing some of these procedures, but there are also cases where it's probably not a good idea to encourage someone to have that obsession with themselves.
And that's it, Dr. Sibthorpe.
That's it for today. Okay. So if you do have any other questions, please go to my website and submit your questions there. Thank you very much.